People will often ask about the way that they have compulsions. Why do they have it the way that they have it? Is this more of a real compulsion than this one? So let's talk about, there's two ways to experience compulsions. An overt kind of physical behavior that you might see somebody doing, like washing their hands, checking the locks. And the other is a mental compulsion that you won't see somebody doing, like saying a prayer over and over again until it's done just right. Now, for people who have almost exclusively mental compulsions in response to their obsessions, sometimes the name pure O is given to that, but really that means that you just have mental compulsions and you're not really going to see physical compulsions going on. For people who are not well trained in OCD, the mental compulsions can be difficult to recognize and understand. In fact, there are people who have come to see me and they have worked with people who only know about the physical compulsions. And they've even been told things like, well, you can't have OCD because I can see on the Zoom your house is messy and everyone with OCD has a clean house. So there's just assumptions sadly made about OCD that we can talk about in another one of these little shorts. Well, I think we'll do that actually. But for right now, let's talk about this notion that you do have to look for all compulsions. And that means also a therapist well-trained enough to know that there are mental compulsions out there as well, who's going to work with you on coming up with ways to interfere with not just the things that happen physically, but that also happen mentally. Going back to the prayer example, if you have scrupulosity, which is OCD about morals or ethics or religion, and you're afraid, what if I said that prayer wrong? And if I did, it's not accepted by my higher power. And because of that, I will not get to spend eternity with them and I'll have to go to some bad place for all of life because I've goofed up a prayer. We're going to want you to purposely allow that prayer to be there, even if it wasn't said in a way that your OCD feels was absolutely correct. Because by doing it over and over again to the way that OCD wants it done, we're doing a compulsion. We're no longer praying to talk to any kind of higher power. We're only doing compulsions to satisfy OCD in that type of situation. So that's the kind of stuff that we really want to work on. And you want to make sure that you're working with somebody who is an expert in OCD, who knows that beyond the physical, there's also the mental aspect of OCD as well. And that's more about misconceptions of OCD. If you want to learn more about that, check out my deep dive video on OCD misconceptions.